Every dentist on every working day makes choices that cannot be answered by technical training alone. Should you recommend a crown or a large composite? Should you sedate an uncooperative child? Should you report a colleague you suspect is impaired? None of these is purely a clinical question. Each one is, at its heart, an ethical question. And that is where our journey begins. Welcome to Bioethics and Society. In this first lecture, we lay the foundation for everything that follows. We start by distinguishing ethics from three things it is often confused with: the law, etiquette, and personal preference. Something can be perfectly legal and still be wrong. Something can be polite and still be unethical. Ethics is not just how you feel, it is a form of disciplined reasoning that can produce better and worse answers. To understand why bioethics exists at all, we have to look at history, and some of that history is dark. The Nuremberg Code emerged from the atrocities of Nazi medical experimentation. The Tuskegee syphilis study, conducted on black men in Alabama for 40 years, betrayed the most basic duties of care. Out of these failures came the Belmont Report, and with it, the framework that anchors modern bioethics, the four principles: autonomy, respecting the patient's right to choose; beneficence, acting for the patient's good; non-maleficence, first, do no harm; and justice, fairness in how care is distributed. But four principles are not a complete map. Behind them stand the great ethical theories: deontology, which asks about duty; consequentialism, which weighs outcomes; virtue ethics, which asks what kind of person you are becoming; care ethics, which centers relationship; and principlism, which tries to hold them in balance. Each offers something. None is sufficient alone. We then turn to a deeper question: what is a profession? A profession is a kind of social contract. Society grants dentists privilege, autonomy, and trust, and in return, the profession promises to place the patient's welfare above its own interests. That promise is captured in the American Dental Association's Principles of Ethics and Code of Professional Conduct. And here lies dentistry's central tension. The dentist is both a healer and a small business owner. That dual identity runs through every chapter of this book. A final word: reading this chapter does not make you an ethical dentist. Ethics is the work of a lifetime. But recognizing how much weighs on even the simplest clinical decision, that is exactly the right place to begin.